Thanks, Jen. Let's go to India and what they're dealing with the coronavirus. The president just spoke with the Prime Minister of India. Can you give us some more details about that? And in terms of how many supplies, what are we really going to rush out there? What's the volume and the scale to deal with the problem?
Sure. Well, as Josh noted, and you may have all seen the readout that we just put out, but just in case you didn't, the President spoke today with Prime Minister Modi of India, committing that the United States and India will continue to work closely together in the fight against COVID. The President pledged America's steadfast, ongoing support for the people of India who have been impacted by the recent surge in the COVID-19 cases. In response, we have provided, and let me give you more of a specific update, and I will also note for you that there'll be an additional call later this afternoon that will provide additional details. So this is just what is available at this point in time of what is being requested and what we are providing. So there are a number of areas that are of great interest and are great need to India at this point in time. Oxygen is one of them. At India's request, we are exploring options to provide oxygen and related supplies. The Department of Defense and USAID are pursuing options to provide oxygen generation systems. We may be in a position to reroute shipments planned for other countries with lower immediate needs, given the urgency of the conditions in India. And we'll have more details, hopefully, on the possibility soon. DoD is also exploring providing field oxygen generation systems, which we have used in our field medical hospitals. Each unit can provide oxygen for up to 50 to 100 beds. And we're also exploring options to provide oxygen concentrators and ventilators, and are in technical discussions with India to ensure the equipment we supply can connect to Indian devices. The United States has already provided 200 ventilators to India last year and trained medical professionals on their use. So this is, of course, in addition to that and other assistance we've provided. Another one of the major needs is PPE. And we've identified U.S. commercial suppliers as well, and therapeutics and tests. But we've identified U.S. commercial suppliers of remdesivir that are immediately available to help relieve the suffering of COVID-19 patients in India. We've identified rapid diagnostic testing supplies, personal protective equipment, and additional ventilators available to be transferred to India immediately. And I noted, of course, we also, of course, are in close touch with India officials at all levels about the raw material needs that they have. And as requested by India, we will provide raw materials for the production of AstraZeneca Covishield vaccine at Serum Institute of India. I know some of these have been announced, but that's just a little bit of additional details. So we're in ongoing discussions about what their needs are and how we can meet them. But go ahead.
Sure. Actually on AstraZeneca. So the opening up of aid, is there any specific measure or urgency to get doses of the AstraZeneca vaccine to India? Is that among the biggest priorities? And then on the India specifically, you mentioned that the idea is to get some raw materials to Indian production of the AstraZeneca vaccine. There are other vaccines that are being produced in India. Will those raw materials also be available to other manufacturers working on other vaccines?
Sure. Well, on the second question, I think I mentioned another vaccine option as well, where the raw materials could be useful for. But I will say that we are continuing to look for a range of ways to help India. So we're talking about what we can redirect, what is available now. A lot of what they need at this moment is oxygen. That is what they will tell you. I know reporters, all of you and your colleagues who are reporting from the region will tell you that we are quite focused on that, as well as PPE, testing, and other immediate needs they have now. But since I didn't mention this earlier, just to be clear, right now we have 0 doses available of AstraZeneca. We're talking about what the FDA needs to go through a review, right, to ensure the safety and it's meeting our own bar and our own guidelines. And we expect there to be approximately 10 million doses that could be released if or when the FDA gives its concurrence, which could happen in the coming weeks. So this is not immediate. And there is an estimated additional 50 million doses that are in various stages of production. These could be completed in stages across May and June. But our team, our national security team, our COVID team, working with the State Department and others, we're going to assess a range of requests, a range of needs around the world. But that's the timeline, just to give you a sense.
And on the Putin summit in production in the U.S., there is, as you know, mounting pressure on the U.S. to support this TRIPS waiver at the WTO. Has there been any shift in the U.S. position? Up until now, the U.S. has not even permitted those discussions to take place on a formal level. Given what we're seeing now, the sort of worst case scenario of the increased incidence in India and Brazil, other places, is there a rethink going on? I understand that there's concern about the emergence of variants and not knowing that, what will happen to those. Are you rethinking the position now?
Well, I'd first say, and I know we'll have a call shortly where there'll be an opportunity to ask a lot of these questions too, but, India has their own IP, right? And they are also a manufacturer of vaccines. Some of it has been delayed. The last time we really communicated about this at a high level was from our USTR, Catherine Tai, but I don't have any updates to that.
And Heidi, one